Okay, we are on the Health Watch as we do every week. We have Dr. Syed Hussain from Trinity Health of New England joining us. Doctor, I just accidentally scratched my ear, so I'm not going to shake your hand. I give a little fist bump. Being a journalist, we were just talking about this beforehand, but I want to catch everybody else up on this. I'm very sensitive to words. Words matter. How things are framed matters. And I'm seeing a lot of doctors out there talking about this winter with a reemergence of COVID and a flu season, which could be worse than usual, calling it a possible twindemic. Personally, I'm worried a lot of you out there are going to hear that and think, uh-oh, here we go. It's going to be a COVID pandemic ×2. While there is some reason to worry about, especially about hospital capacity, I would hope you sort of follow that. I don't know that we want to call this a twindemic, even though we know what they're getting at. I mean, what is put this into context?
Yeah, what it basically entails, Tim, is that we may see a higher number of COVID-19 cases as well as flu cases, and especially flu because we haven't seen a large number of flu cases over the last 2 years because of various public health measures in place. Yeah. So there's a twin peak in number of cases that, has the potential to overwhelm, but I think we're much better prepared now than we've ever been to deal with respiratory illnesses. Now, having said that, folks need to keep in mind we have really effective tools in our midst, and those are vaccines. Yeah. The reformulated bivalent booster for COVID-19, now is the time to get that along with your flu shot so we can prevent further disease and suffering during the course of the winter months.
And it does look like a lot of healthcare providers are making it easy to schedule both at the same time. I know I was just looking on CVS's website. I live right down the road. They say, hey, do you want to get them both at the same time? You click a button. It's as simple as that, too. Talk to me, though, about the possibility if we do not get these levels of boosters and flu vaccines up, what that might do just for hospitalizations, given the state of our healthcare system in the country.
Sure. So we know modeling tools that we've tweaked and developed over the course of the last 2.5 years really have helped us predict future surges. So if you look at modeling now for COVID-19, if we stay on the same track that we've been in terms of number of people rolling up their sleeves, getting the bivalent COVID-19 booster, it's a very low number, which means we are on track to seeing a record 90,000 people possibly die over the next 6 months, pushing up that daily average of people dying from COVID-19 from 300 to 400 nationally to up to 1,200 at a winter peak. Yeah. All of this can be prevented.
Yes.
If folks roll up their sleeves, get the vaccine, at least similar to what the flu vaccine uptake was in 2020, 2021 flu season, then we can reduce all this suffering by almost 75,000 deaths. So
can you just imagine this is where we've reached in 2022 when we're talking about 90,000 people in the U.S. alone might die in the next 6 months. I'm not getting a sense it's registering with the American public because of COVID fatigue.
Yeah, there is fatigue. There's also a lot of misinformation. There's hesitancy related to vaccines. So we need to do our part in terms of educating folks. A record number of vaccine doses have been administered now since we started this COVID-19 vaccine campaign. So, none of those, wild theories have ever come to fruition. Yeah. So it should give people, confidence in how effective and safe these vaccines really are.
And one last time, how about timing? I mean, Thanksgiving is when people are getting together inside. When do you need to be getting those jabs to make sure you're fully protected?
So optimal timing is now. Especially all of this month in October. Remember, it takes up to 2 weeks for the body's immune system to be primed and ready to fight this virus. So we need to give that time, especially when we have holiday gatherings and all that coming up in the next several months.
There you go. We just keep getting that word out. Dr. Hussain, thank you for joining us again, as you do every Wednesday. Dr. Syed Hussain from Trinity Health of New England, our go-to expert on so many things